Today I wanted to talk about treating neuromodulators in the lower face. I was actually one of the principal investigators here in the US that investigated Botox for the use of what's called platysmal bands. When we go like this, we create what's called platysmal bands, and these can become more apparent with action. Sometimes they're there what we call statically as we age. And so in that investigation, we were treating along the jawline and we were treating individual bands to help soften the appearance of that lower face. What also is really interesting in the last several years is that there's some really pretty changes that happen along the jawline when we treat this upper portion of the platysma. So if we treat something called the DAO, which is a muscle that goes from the corner of our mouth down to here, it's this one, and we also treat superficial portions of the platysma, that consists of doing some drops of toxin along the jawline. When the mid-face was looked at, so looking at sort of the cheek region, because the platysma tends to pull the face down, when we relax it, it actually lifts the face. So if you're looking for options that don't involve filler and you're wanting to do something to sharpen the jawline and to help with the mid-face, treating with neuromodulator in the lower face may be something you want to talk to someone qualified in and is something that we specialize in. Ideal candidates, maybe someone who's not ready for a filler in terms of the jawline. So if you're someone who is open to getting neuromodulator and already receiving it in the upper face, you may consider getting treatment in the lower face. Because this muscle is overactive, I think if we soften it, some of the aging changes we see in the neck may occur more slowly. We can benefit from keeping a sharper jawline, and maybe some of that rejuvenation that we talk about in the upper face, we can augment in the lower face as well.